in this ranking. But let's go on to Skype now and engage Professor Stanley Okolo, who's the Director General of the West Africa Health Organization, WAHO, to understand what this West Africa sub-regional picture looks like and how we should be responding. Prof, good evening to you. Thank you very much for joining us this evening.
Thank you very much. Thank you.
I just painted, let me just say that Prof is speaking to us from Abuja, Nigeria. I just painted the West Africa situation, and you are in Abuja where Nigeria is leading in the cases. How does the West African Health Organization react to the increasing cases in the sub-region?
Well, you know that one of the things that we're really keen on in terms of this coronavirus is how do we contain it through massive testing, how do we contain it through social distancing, and how do we contain it through some of the public health measures that we have continued to push with people. Two pictures are emerging. The first is that there has been an increase in testing. When we look at how we have ramped up testing, that has increased and from week to week. The second picture that is emerging is that there appears to have been from week, what we call epidemic week, is dependent on when we had the first case of coronavirus in the region. So we're now in week 15 because the first case was on the 27th of February. By the time we were in week 12, we noticed that we had a peak that started dropping, but it appears that from about week 14, we started having an increase again. So one of the things that we're seeing with these pictures are, number one, some of it is being contributed by increased testing. But number two, we now have community transmission across all our 15 member states. If you were speaking to me about 3 weeks ago, I would have said to you that 2 or 3 member states only had sporadic or cluster cases, but now all 15 have community transmission. The second thing is that we really have to again push on the issue of risk communication. Part of the pressures, which we appreciate and understand, is that a lot of people, because of the economic downturn, because of the lockdowns, a lot of people felt almost as by the time that some of the lockdowns were being eased, that we are the end of coronavirus. We are not. And that is why your reporter who went to the market saw that where people were previously complying explicitly with some of the social distancing and the non-pharmaceutical measures, that has dropped a bit. So we now have to work with community leaders, with religious leaders, in order to push this.
I see. You mentioned a critical situation of non-compliance and effective implementation of the protocols. Do you have specific concerns about the approach that some countries in the sub-region are taking in this fight?
No, not really, because when we look at the approaches that are being taken by all our countries, in fact, at the moment, all our countries, we can group them into a maximum of only 3 groups. There are those who are having massive testing, just like what you're having in Ghana, where you've so far tested close to 300,000. I don't have the exact figures, but you also understand that your positivity rate is low because you're testing a lot of people, and therefore you find that at the moment, the positive based on the test is slightly low. So there are those of people who are having massive testing. There are people who are having testing of what initially was WHO recommendation in terms of suspected cases and contacts, but that's a smaller number. And the greater number of countries are now having testing of suspected cases, contacts, and targeted population. So if you're of the those who are vulnerable, those who have comorbidities, you're tested. If you go into hospital with any illness, they test you whether it's classical of coronavirus or not. So really, I'm not concerned at all.
Great. Finally, there's concern about growing incidents of health workers contracting the virus in the sub-region. For example, in Nigeria, in May, some 113 health workers infected by COVID-19. Here in Ghana, it's the same story. We have increasing cases of health workers being infected. Is there a strategy that you're proposing to specific countries in dealing with this?
Yes, and our organization is really concerned about that. WAHO has been keeping the records because we get all this from all the countries. And what we are looking at is not just we've already started doing, is to target countries in terms of online training. Because remember, there are two issues for where health workers contracting coronavirus. One is the availability of PPEs, what we call personal protection equipment. But in addition, there is also the training in terms of infection prevention and control practices, even simply how you put on the PPEs and how you remove it. And then some of those infection prevention and control practices. So we are now having online training that is targeted particularly to countries where we find that there is a high proportion of healthcare workers being infected. We have delivered and supported countries with PPEs, but in addition, we're bringing in a lot of PPEs, which hopefully will start arriving in the region from sometime next week, to again continue to support the countries with PPEs for frontline healthcare workers. Right. And then the final thing is, as we increase the number of people, whether as volunteers or extension health workers, it is vitally important that we train them appropriately in terms of infection prevention and control before putting them on the field.
Professor Stanley Okolo, I want to thank you so much, and we know we'll be connecting with you as we go on in the coming days to understand what's going on with strategy for the sub-region. Thank you, and do have a good evening.
Please keep up the good work in informing the public. It's really important, the risk communication, because we can take hold of this ourselves as individuals and as a population. Thank you so much.
Thank you, and I appreciate your time this evening. Professor Stanley Okolo is the Director General of the West African Health Organization, that's WAHO, for the sub-region. And remember, we all have a role to play. Adhere to the safety protocols so we can all stay safe.